On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey, good evening, everybody. Welcome to another episode of Talking with Dr. Donna. Thank you so much for keeping your appointment. As you know, you have an appointment with your doctor every Thursday here on Talking with Dr. Donna. So listen, tonight it's going to be a tough night. I'm warning you now because we're going to talk about the state of Black health in Alameda County specifically. So it's going to be a hard conversation. So I'm going to do this tonight just with me. And we're going to go through these things. So of course, as you know, this is season 4 of Talking with Dr. Donna. You have an appointment every Thursday at 6:30 p.m. And the reason that we do this show, Talking with Dr. Donna, is because we are building a generational health network. And I know sometimes you all may, if this is your first time with me, be thinking, well, what is generational health? And so this is a phrase that I have taken on. I won't say I coined it because we've talked about generational health, but I really have embraced this term of generational health and building a network around it. And there are 4 pillars of health to my generational health network. And that's because we all know that health is not just about our physical selves. So my 4 pillars of health are really thinking holistically about our health. So my first pillar is emotional and mental health. So understanding that our minds are connected to our bodies. When we're stressed, when we're sad or depressed, all of those things come to impact our own health. My second pillar is spiritual health, because this is not about religion, though. I want you to understand that it's not about religion. It's that studies recognize that when people believe in a higher power, that they are healthier, that they are happier, that they heal better when they are sick and in the hospital. And that is the spirituality that we're talking about now, is recognizing that there is a higher power who may be in control, who is in control, not maybe, who is in control when you are out of control or out of health or in poor health or in poor wellness. So it's the spiritual connection. We're all spiritual beings, and it's that connection to the spirit that will improve our health. My third pillar is physical health. That's an obvious one, right? I'm a physician. We talk about our bodies and our bodies being as healthy as possible. So paying attention to our physical bodies, understanding when our physical bodies need help, when our blood pressure is high, when we have diabetes. All of these things are dealing with our physical health. And lastly, and this is something that I don't think a lot of people even pay attention to, but it's environmental health. So thinking about the soil that our food grows in, the air that we breathe, and how those things impact our health, because they do. So these are my 4 pillars of generational health. And I truly believe that if we pay attention to these 4 pillars, that we start thinking about these 4 pillars from the time that the baby is in the womb of the mom, and particularly when they come out, that if we pay attention to those 4 pillars of health, that we can make a generational shift in our health in the Black community. As we're going to talk about tonight, we as Black African Americans have some of the highest mortality in almost every single disease category. That means that it didn't just happen in our generation. It didn't just happen today, but this is decades years of poor health, most likely systemic racism adding to that, that is causing our health to be poor today. And we're going to see that in a few slides. Generational health is also recognizing that we have the power to change some things about our bodies. And if we do a change today that can turn off a gene that normally is turned on to make disease, if we turn that gene off, that turning off that gene can impact the health for the next 4 generations. 4 generations. That should be, number one, exciting, because that means that we do that. What we have now doesn't mean that it has to be forever. It's exciting, but it's also sobering. And to think that perhaps the health and the condition of the health that we're in now doesn't really have to do with us and what we're doing today, but what generations have done before us. So let's start this journey of generational health right now in our generation, so that successive generations can be healthier than we are today. I'm live, which means that my chat is live. So I see you out there. Thank you all for keeping your appointment tonight. So if you have a question, you can put it in the chat. If you have a comment, please do put it in the chat and let me know that you are watching, that you're here, that you're paying attention. So there's many different ways in which you can connect with me, and I would love for you to connect with me. You can connect with me on Facebook, you can connect with me on Instagram, and of course here on YouTube every Thursday at 6:30 p.m. when we go live, you can connect with me. I only have 2 asks. I have 2 asks when I do this show, because I do this show really to educate you, and oftentimes I'm even educating myself. I want you to just do 2 things for me, just 2 things. Number one, if you're not already a subscriber, I would really appreciate it if you went to my YouTube channel and subscribed. My second ask is that you share this information. This show is not just about you learning the information, but it's about our community learning the information. So as you learn, as you gain knowledge, I would love for you to share your knowledge with someone else. So those are my 2 asks for keeping your appointment with the doctor, is subscribe to my channel and to share this information as you receive it. All right. So let's talk a little bit about breast cancer. So this is October. This is the last Thursday in October, but I've been wearing pink every Thursday because it is Breast Cancer Awareness Month. And that awareness is key, because it's not just about me understanding what breast cancer is, but it is being aware of how that breast cancer impacts me. I've told this story all month long about the significant history of breast cancer in my family, and I want you to be aware of if there's breast cancer in your family. I want you to be aware of the current screenings, that you need to make sure that you do a self breast exam every single month. Women, as long as you have breasts, you have the ability to develop breast cancer. Breast cancer, unfortunately, is the highest cause of cancer deaths in the Black community. It's also, even though Black women are not diagnosed more often, Black women die more often from breast cancer. So us being aware of how to screen is important. You want to make sure you do your monthly self-breast exam. If you no longer menstruate, then just choose a day that you're going to remember the same time every month. My birthday's on the 12th. On the 12th of every month, I do my self-breast exams. You also want to make sure that you do screening tests. So you want to make sure you get your annual mammogram. Every year, get a mammogram. I know that there are recommendations that say you can stop getting a mammogram once you hit the age of 65. And as I've told this story this entire month, my mother was diagnosed with breast cancer at the age of 75. So as long as you have breasts, you have a risk of breast cancer. I want to make you aware. I hope that you have learned about breast cancer in this month, as we had Dr. Rhodes last week really talking about breast cancer and if you're diagnosed, where to be treated. If you did not see that episode, I encourage you to go to my YouTube channel and look at the episode from last week where we really talked about treatment for breast cancer. So monthly self breast exams and annual mammograms. If you have dense breasts, which a lot of Black women do, then you want to also think about getting a second type of test if on your mammogram it states that you have dense breasts. That means getting an ultrasound or getting an MRI in addition to your mammogram. All right. And that means getting your mammogram screenings, like I said, annually, and starting at the age of 45 if you don't have a significant family history of breast cancer, or starting at the age of 40 perhaps if you do have a significant risk of breast cancer. All right. So I see you all in the chat. I see you out there. Hi, everyone. Thank you so much for keeping your appointment. All right, let's get into tonight's episode. Like I said, it's pretty heavy, but I wanted you all to know this because a lot of people often say to me, Dr. Donna, why is it that your show does emphasis only on Black people, right? Because that's what I say, that my mission is to help end the cycle of death, premature death. Premature death. That means death that is unnecessarily happening too early in the Black community. And so tonight we're going to talk about why. Unfortunately, I'm going to talk about why. Earlier this week, the Board of Supervisors, led by the president and the co-chair of the Health Committee, the Board of Supervisors had a health committee and they held a hearing. And the hearing was on the state of Black health in Alameda County in particular. So the slides that I'm sharing tonight are straight from the Alameda County Public Health Department Healthcare Agency as they were presented by our medical officer in the Alameda County, Dr. Nick Moss. So he presented some data about the state of Black health. And when I was watching the hearing and hearing the data, I can tell you my heart was breaking with every single slide. Oh my gosh. And so I thought to myself, wow, this is why Generational Health Network exists. This is why I do Talking with Dr. Donna and why you can keep your appointment every Thursday, because we are at the top, one or two of every single leading cause of death. I'm going to guess it's not just in Alameda County. We are not an anomaly in Alameda County. It's in the United States and counties across the United States. This looks the same. So let me tell you what you're looking at. Okay. They give here different diseases. We have heart disease. We have cancer. We have COVID-19, diabetes, stroke, Alzheimer's. Okay. African-American box is in orange, outlined by purple. The number scale as it goes up is the number of deaths from that particular disease. And it's broken down by other races. So you see there's Pacific Islanders, there's Native Americans, there's white, Hispanic, Latino, and Asian. So this is pretty much all of the ethnicities in our county. And if you look at heart disease, number 2, African American. If you look at cancer, tied for number 1, African American. If you look at COVID-19 deaths, we're number 2. If you look at diabetes, number 2. If you look at stroke, number 1. If you look at Alzheimer's disease, number 1. So what I'm saying is that this is why we focus on African American community on Talking with Dr. Donna, not because other races are not important, but because when you look at African American community and our causes of death in every single category, we are either number 1 or number 2. Now, I know you might be saying, well, what about Pacific Islanders? They're pretty high too. And that's true. But that group is so small compared to the African American group that perhaps that data is skewed. It's also an amalgamation of all different types of races in the Pacific Islander group. So it's not homogenous in the same sense as African Americans. We're all Black. And so the fact that we have number one or number two in almost every single one of these leading causes of death in Alameda County, that to me is extremely sobering as a physician, as a Black woman, to recognize the premature death that is in our community right here as demonstrated on this graph. So we're going to go through some other statistics because, again, this is important for you to know. So that was graph number one, just generally thinking about what it is that we're looking at. And now I'm going to go through some other types of graphs with some other information so that you can understand, again, why we focus in on premature death in the Black community on Talking with Dr. Donna. I'm very, very serious about this. And I know people people ask me all the time, well, can you talk about this with Asians? Can you talk about this with other groups? And I say, no, my show is about Black people. It is the Black community here in America and across the diaspora. And tonight, there's the evidence of why. All right, so we've talked about leading causes of death in Alameda County. Now, this graph, this right here, also got me because we're looking here at death by race and ethnicity, and we're looking at death by your income. And again, we're looking at African American, Asian, Hispanic, Latino, and white, and we're comparing how the deaths versus your income. Okay, so if you look at the top of this graph, African Americans in that orange line is the highest of the graph. From the most affluent, so the richest, to the poorest. And what this graph is saying is that it does not matter your income level as a Black person. Does not matter that you, rich Black person, are still dying more often, almost twice as more often as a rich white person, or 3 times more often as a rich white person, and almost twice as more often as a rich person of Asian descent and a rich person who's Hispanic and Latino. If you're poor, if you're poor and Black, you're still dying more often than Asian, Hispanic, Latino, or white poor people. Doesn't matter the income. African Americans are dying at a higher rate than any other ethnic group, regardless of our income. Sobering, right? Because you think, well, if you're Black and you make more money, that means that you're going to have better health. Well, it's true, you have better health than a poor Black person, but you do not have the same level of health as a rich white person, a rich Latino person, or a rich Asian person. That is a problem. That is a problem. That is a problem. All right, so I want you to see that because I want you to understand that this issue of premature death in the Black community is a huge, big deal. And we better start kicking up our heels and kicking up some dust about this, okay? Like I said, tonight is going to hurt. It's going to hurt. It's going to hurt. All right, let's look at our babies. Now, you all know, as a pediatrician, infant mortality has always been on my radar. I developed programs to help educate on sudden infant death when I was the chair and the chief of pediatrics at Alameda Health System. This was my project. This is one thing that I said before I leave Alameda Health System. Our mothers are going to understand the risk factors of sudden infant death syndrome because we are going to make a difference in our infant mortality rate. We have not. And unfortunately, all the work that I did at Alameda Health System to talk and educate our mothers about sudden infant death completely went away when I left Alameda Health System. When I left our labor and delivery unit, the education, the emphasis on it went to the side. It is because if you don't have a champion of a disease and a process, then nobody else cares. This is also why it's so important that we have African American physicians, because if we don't talk about it and we don't bring it to the forefront, nobody else cares like we do. I'm not saying nobody else cares, I'm saying nobody else cares like we do. These are our Black babies who are dying. I care. So let's look at this slide. Again, in the orange, African American, Black. Looking at other races, all other races, dotted line, that's all other races. We've got the green, Hispanic Latino, the kind of bluish, white, and then the darker purple, Asian. These are the number of babies who die per every 1,000 births. Who has the highest number on that y-axis, the number of babies dying per 1,000? African American babies. In 2008 to 2010 census, our babies were about twice as likely to die from multiple different causes, but twice as likely to die than the closest one, which is Hispanic and Latino. Okay. But that's just the closest one, right? But let's look at looking at the white babies, right? White babies were probably 3 times back in 2008 to 2010. We had some breakthroughs. We had some horrible years, but now here we are again, 2018 to 2020 data, and we are closer to, again, 3 times an increased risk of dying. Our Black babies 3 times an increased risk of dying than any other, all races together. But again, if you look at white babies down at that bottom, we're probably 3.5 to maybe even 4 times more likely. Our Black children 4 times more likely to die than children of other races. So we've talked about just overall health, that Black people are either number 1 or number 2 in all causes of death in Alameda County. We've looked at the fact it does not matter your income. Rich Black people die, or more affluent Black people die more often than more affluent white people. And that carries all the way up to poor Black people dying way more often than poor people of any other race. And now we're looking at our babies, the same pattern. Our infants, our Black children are dying more often than children of any other race. I told you, it's tough. This is tough because it's us. It's us. And we need to recognize that it's us. And what are we going to do about it? Well, then there's things like homelessness, right? If we look at, well, who is homeless in Alameda County? And homelessness again spans all populations. It's not just one population or race, people who are living out in the streets, but it is, looking at this data, African Americans right here in this purple, dark purple, in 2021 year, as well as 21 and 22, over 50% of people in Alameda County who are homeless are Black. Over 50% of people who are living on the streets, unsheltered, not really getting proper health care, not getting proper shelter, living out in the cold are Black people. And we all know that homelessness contributes to health. We all know that not having a safe place to sleep, not having access to good water, not having access to food impacts your health. So it's not rocket science for us to understand that if over 50% of the people who are homeless in Alameda County, then that means that makes sense that we have the highest rate of premature, gosh, I can't say that word enough, premature, dying earlier than we should be dying because of poor health. All right. You guys had enough? You've had enough? Oh, still a little bit more. Now, we've been talking about COVID-19 and the pandemic. We've been talking about it over and over. You guys are probably tired of hearing about COVID, but I have to, again, give this information to you because knowledge is power. When we know more, we know better, we're going to do better. And when we know more, we know what to fight for. We know what to tell our leaders what we need in our community. So looking at COVID-19 and mortality rates, we've talked about this over and over and over again on this show. We've talked about the mortality. We've talked about why we're vaccinating our community. We've talked about why it's important for you to go get your COVID vaccines, why it's important for you to social distance when we were doing that, why it's important for you to wear a mask even today, if you can, when you're out in public. It's because here we are again, COVID-19, African American residents, 53% of the mortality rate, COVID-19. So here we are in our box right here, and we can see that we have high numbers across the United States. Again, I said this in the beginning, this has nothing to do with just Alameda County because we're not an anomaly, unfortunately. I wish we could say we were an anomaly, that we could look at other counties and say, hey, well, what are you guys doing that we're doing wrong? But this is in counties across the nation. African Americans are dying from COVID-19. As you saw in the very first slide, it's the number 3 cause of death in Alameda County, COVID-19, from heart disease and cancer, COVID-19. And African Americans are dying more than any other race from COVID-19. So very, very, very sobering statistics. And when we think about, well, what are we going to do? I want you to amplify it. I want you to tell people. I want you to let people know, hey, we've got a problem with our health in our community. And that means that I want you to not be lax about your own health, to not be lax about how you're taking care of your mind, your emotional health, your mental health. I don't want you to be lax about thinking about your spiritual health. How are you feeding your soul, which feeds into your health? I don't want you to be lax about your physical health. And I know that we always say, oh, well, I'm big boned. I really don't care what kind of bonedness you have. You got to move your body. You got to pay attention to what you put into your body, what you're eating, what you're drinking, how much you're moving, how flexible you are. Because we know as you get older, if you're not able to move around, if you're not able to bend over and touch your toes, if you're not able to twist, that increases your risk of falling, and that increases your risk of having poor health when you're older. That's going to increase your risk of premature death. And lastly, I want you to pay attention to our environment. Our environment is important. The type of houses that we live in, whether there's still lead in the paint in the walls, whether there's lead in the water the pipes that you're drinking, whether the soil of the house that you're living on was built on a toxic waste dump, whether the schools that our kids are going on and the places that they're trying to drink water, whether there is pollution in the the underwater that's seeping up into the water supply of our kids' schools, whether the soil that we're planting our food in is healthy enough for us to even eat, the air that we're breathing, whether it's causing us to have asthma, exacerbating our COPD, whether it's getting it's causing more problems. All of these things are important. We got to talk about it. We got to be real about it. And we need to amplify it and tell other people about it. because it's important for us to speak up. So what are we going to do about all these statistics that I presented tonight? The state of Black health in Alameda County. What's going on? So we are convening, we're talking, we're trying to figure out what our next plan is. There's a group of physicians here in the Bay Area where we focus in on exactly this type of issue. My colleagues, my girls, my friends, Dr. Kim Rose and Dr. Noha Avalada, we meet every other Friday. Dr. Damon Francis, we're meeting every other Friday talking about these things, talking about what we can do in our various roles to help make sure that the story that I just told you tonight doesn't remain the same story. Really thankful for Supervisor Keith Carson, who's convening a meeting on Monday of all people in the sectors, of various sectors, in the spiritual sector, in the medical sector, in the mental health space. We're all coming together to really talk about this data. So that's what we're going to try to do on a systemic level. But what are we going to do about it on a local level, community level, and individual level? That's what you have to decide for yourself. You see the data, you see the statistics, you understand the issues, you know that we have a high risk. What are we going to do individually to make a change? We have got to protect our next generation. Generational health is about ending the cycle of premature death in our community so that the next generation, our kids, can live healthier lives, longer lives. So tonight, as you're sharing this information, if you share this show, I want you to think about what you're going to do, and I want you to share that too. So as you know, we talk about our food of the month. We always do a food of the month because it's important for us to recognize that the food that we put into our bodies is important. And so I'm talking about this because I want us to think, to expand the foods that we eat, to think about how we can eat differently, to introduce different types of foods to our families, whether they want to try some things different or not. So this month, in honor of Breast Cancer Awareness Month, we've been doing pink food. So we've talked about eating beets. And I know I had some beet ice cream. That was amazing. Bridget is out there who did a beet smoothie. So hopefully Bridget will take a picture of it and share it on our page. We did cara oranges, right? So that pink flesh and the importance of that in our foods. And tonight we're going to do another food, which you all have probably seen in the store, and you're kind of like, what the heck is that? And so tonight I want you to think about dragon fruit. It's our last final pink food of the month, dragon fruit. And it looks crazy. It's not a pretty fruit on the outside, but it's got a lot of good health benefits. It's really low in calories. It's kind of sweet. It's sweet. It's easy to peel that pink skin off and just get that fruit in. And you can add it to foods. You can add it to drinks and make smoothies out of it. It's high in antioxidants, high in fiber. It can help you with your weight loss, reduce liver fat, help with insulin resistance, right? So that's that type 2 diabetes, the diabetes we get as we get older because our bodies no longer are using insulin smartly. It helps to decrease inflammation. Almost every single fruit that we have given you this month decreases inflammation. And the reason that we're talking and wanting to decrease inflammation is because then we know that inflammation causes heart disease. It causes all types of cancer risk. It does things like asthma. Almost every single chronic disease has some form of inflammation, and we want you to decrease that in your diet. So dragon fruit is our fruit of the month for this week. And fruit of the week for this month. I want you to try it out. I want you to take some pictures of how you're eating dragon fruit and share it. Share it. Share it. Again, amplify the message. All right. Deep breath. Woosah. Because that was tough and that was heavy. I know. And I really thank you for listening and keeping your appointment tonight, because again, this is what this show is about: building a generational health network, recognizing that what we do here on Talking with Dr. Donna is important, and valuing the information. So again, my 2 asks are: number 1, if you're not already a subscriber, that you would subscribe to my YouTube channel, and please share this with someone. That's my second ask, that you share it with someone. And when you share it with that person, if they liked and heard anything that was important to them, that they appreciate, that they're willing to share, that they then subscribe, so that we can continue to do this work here at Talking with Dr. Donna. Okay? I love you guys. I love my community. I love my people. And I really don't want us to continue down this road of being the number 1 folks who are dying from every single disease. So I know tonight may have been tough, may have hit hard, but hopefully what it does is it empowers you to make a difference, just even in your family, in your individual life, and in your community. All right. Well, thank you again for keeping your appointment. You have an appointment with the doctor every Thursday at 6:30. Again, if you are not a subscriber, go to my YouTube channel and subscribe, and then make sure you share it with someone. So thanks again for watching Talking with Dr. Donna, for keeping your appointment. Thank you in advance for sharing. And you guys take really, really good care of yourselves. Until I see you next week. Talk soon. With Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe.